Welcome, everybody. I'm one of your hosts for this event today, and this is the first webinar of the year in SenzMate's Connecting the Futures. It's number 17. So this is actually, this has been going for a while, and I know a lot of you have been to some of our events before. And it's not the first time we've had a webinar with the word trust in the title. It's a different focus than we had previously. This is a subject that keeps evolving, keeps changing, keeps maturing, and it's not going away. So we are revisiting it. And not to kind of go over what we said before, but because this is a conversation that we need to keep having. Now, I'm one of your hosts. I'm not the only host. Bringing on, let's see. Oh, Ruben. Welcome.
Thank you. Happy New Year to everybody. I mean, we can't believe 2026 is already here. And it's a wonderful thing to meet. Actually, it's like kind of first full week of it. Yeah.
And Santa's gone, and we're back to work. Hi, Sarah. Thanks. Great to have you here. Chat's open. So everybody, don't wait for the Q&A to start. We're going to be addressing the questions as they come up, and a lot of them will be bringing them up in the after party. And I know a lot of people there watching us are on LinkedIn Live. We're also on Zoom webinars. And this is important because we're also going to have an after party. Immediately after this event ends, we go to an after party where we're bringing on members of the audience, either on microphone or camera, to speak, interact, share what they're building, share their challenges. And if you're on LinkedIn Live, you need to hop the fence onto Zoom webinars, because the after party is only on Zoom webinars. We can't bring you on camera on LinkedIn Live. And also, we don't make the recording of the after party public. We do sometimes, I know people see clips from the after parties. It's because we have been given their consent to use that clip. So if you speak in the after party, you're not going to appear in a recording. You're not going to appear in a replay unless you've given us your consent. So, Ruben, should we start with our first speaker?
Yeah, I think it is important. I mean, that as you mentioned, that trust one side and the healthcare cost on the other side, with, I being in US, things are going through the roof about the cost side of it. And while the doctors are overworked, so I think really need to see from the, our panelists as well as the audience, how we are going to be dealing with this one. And this is a great topic to start. Let's go for it.
All right. Welcome, Akanjali.
Hello. Good evening, good morning, good afternoon, wherever you are, to all the audience members.
Akanjali works in digital transformation in healthcare. She comes from a clinical background, and she's does this work in several organizations. She's giving us the clinical POV. And I wonder if you can frame this event with, why is this subject specifically in relation to controlling costs? Why is it important? And how is this conversation evolving? We've had this conversation, we've been in these conversations for the past year. I know you've got your finger on the pulse on the healthcare side.
Yes. So let's start with this. Having worked on the clinical side, on the service delivery side as well, what is the promise that AI offers us? Why are we so excited about it in healthcare? And it's what is within the question, right? The costs. Healthcare is extremely costly to public, private services, and AI is the promise that delivers better outcomes with more operational efficiency, as well as financial efficiency. So really, that's the promise upon which we look at these tools. Then if you look at it the other way around, what do we mean by trust here? And I think that's what you were alluding to in your opening statement, Jose, with how that conversation's changing. So this time last year, perhaps I met more clinicians, more colleagues of mine who were a lot more mistrustful or resistant to adopting AI in their clinical practices. Nowadays, most of them are very much encouraged to use it. That said, their experience of the AI is not the same. So I recall one day having a coffee conversation with two colleagues about their use of an AI tool in their practices. It was the same tool, and it was fascinating to me that their experience of the same tool as clinicians of the same stature was completely worlds apart. One was like, yes, this is brilliant. This has really improved the efficiency in my practice. I love it. This has really brought our costs down, allows me to spend a lot more time with the patient. The other clinician, by contrast, completely hated it, thought it was a waste of time, will be unsubscribing, thank you very much. So the question is, how did that happen? Was it the tech itself? And there might be an element to that, where as we iterate these products, as we look at those workflows, and that's a separate conversation we've had on a different webinar. But actually, it's how that AI is being deployed. Who is using it? What is the ecosystem it is landing in? Is the data, the infrastructure in that environment ready to use that technology, ready to leverage that model in the best way? Or actually, is there some work to be done in cleaning that up and making that more reliable? What does that user understand about AI? And these days, with sort of consumer AI at our fingertips, sometimes people are afraid to say, I really don't know what you mean by that. There's this sort of understanding that we all know what's going on or something like that. But actually, when you get deeper into the conversation, sometimes I find myself saying, actually, how does that work? I conceptually understand it, but I'm not understanding what happens if the data goes here, or if the patient misunderstands this, or if I miss a hallucination. What does that actually mean for me? What does that mean for me legally? What does that mean for your governance structures? Do you have a support structure in place to help me as a clinician adopt this into my practice in a way that you would support me and provide assistance in that? So those are the questions that I really think trust is hinging on. And it really gets to the crux of the matter to me. What is trust? It's not just an emotion. It's not something that we hope to just gain from people by making something shiny, new, easy to use, reducing the barriers of entry for them to access it. But it really hinges on operational outcomes. If the outcomes are there, you're managing to support the users to achieve those in a reliable way that adheres to the regulatory guidance, supports them to do their work, and the outcome then eventually speaks for itself. So when those aren't met, that's what leads to workarounds, duplication, disengagement, and that's then what drives those costs up and really creates a bit of a cost illusion, actually. You think you're bringing costs down, but without that trust, without that strong operational outcome supporting it, really what you're doing is the a temporary solution to a much longer term problem. So trust is not a communication issue. It really is an operational one. How that AI is deployed, who it's deployed to, how they're being supported to bridge those gaps, to clean up the environment upon which that piece of tech is landing is what I think this all hinges upon.
Thank you. Ruben, do you have anything you want to add to that before we go to our next
I think
speaker?
it is the way you articulate it so well, and I think we will be addressing one of the angle of that is rather than throwing this AI boogeyman, just show to this audience or the patients actually on that front how they are getting help here. How what is this one helping them get the best solution and personalized medicine kind of thing, and some of these education will be helpful also.
Absolutely. And Ruben, to that point, some of the smaller practices, smaller players are the ones that are keen to use AI to keep their costs down, because actually they're in a much more resource limited environment. Yet
Exactly.
they then paradoxically don't have the support to deploy that AI in a meaningful and effective way. So I've actually found that it's smaller players that are more willing, because they're sort of looking for anything to help improve their efficiency in a service, yet they then don't have the background support to back that up, and then that doesn't really go anywhere, which is sad to see. It's just a sort of mismatch there that I think hopefully this conversation today delves deeper into.
Yeah.
Thank you so much, Akanjali. We're going to bring Akanjali back for closing comments before the after party. Thank you, Akanjali, for kicking us off. And let's see. Alex. I can't see you, Alex. Alex, are you there?
I am here. Yes, I am.
There you are. And thank you so much, Alex, for coming.
Thank you. Right.
And Alex, Alex, you're a health economist. I thought that we ever actually done this before. You're a health economist that works at the NHS in procurement and policy. And I think you might be the first speaker. No, Akanjali actually did this with Akanjali, where we actually brought you back 2 webinars in a row, back to back. We don't usually double tap, but I really wanted to get your perspective on this event, on this topic, because you've seen a lot of the hard data about people trying to reduce healthcare costs, and you've studied how this impacts trust in the organizations. And I wonder if you want to, have I done a good job of introducing you, by the way? Is there anything else I left? Is there something important I left out?
No, that's okay. Thank you, Jose. I'm delighted to be here speaking again with this incredible panelist as well. No, you introduced me well. I work in the National Health Service in England. I am based in Manchester. I am originally from Mexico, and I've been living here in the UK for more than 10 years now. So yeah, very excited to bring my view into here. My current role is as an evaluation manager working at Health Innovation Northwest Coast. That's the name of my organization, and very happy to bring my views in here. Thank you.
I wonder if you could be the bad guy for a minute. And we always talk about positive examples, but I actually wanted to start with a negative one. And I know you don't want to probably name names and shame people, but I wonder if you can give us an example of not necessarily a particular company or a particular solution, of an approach that doesn't work, where a cost-cutting measure using AI destroyed trust and increased costs. And I imagine you probably don't want to, I don't know if you can speak in general, just to give us a bit of perspective, a negative use case.
I'm going to try and give a balanced perspective, hoping to share a bit of my experience from the projects that I've been working on for some years in the UK context. So that's where I'm coming from. Before coming into this good and bad, let me try and reframe a little bit the question to explain how I understood it. Can cost reduction and trust be achieved at the same time? My answer is yes. So I'm going to try and start with a positive note in here. If we sacrifice trust, AI will not deliver value for money. So for those familiar with economic terms, value for money is, does this make sense economically? Yes or no? So in fact, sacrificing trust will make AI more expensive. And I'm gonna touch on good and bad, just sharing 5 key reflections that I have prepared when you have asked me to join this panel. Jose, I hope that's okay. Mm-hmm. So my first reflection is cost-cutting AI that sacrifices trust is a false economy. So Akanjali just mentioned an illusion. And that's right. For me, That's what I've seen so far. So when AI is introduced as a cost-cutting tool without engagement, transparency, and securing the buy-in from people, it destroys trust and increases the costs. If trust is low, uptake will be low, and the cost per unit of benefit, or the benefit, will be more costly. So a bad approach, without shaming anyone. I've seen in a couple of projects that treating AI deployment as a black box, just aiming to reduce staff time per patient and saying that people will have automatically more time to see patients, it's a false economy, an illusion. Minimal training and no explanation of how decisions are made, just embarking people for the sake of being part of a project, that's another part of an illusion. AI imposed through mandates rather than clinical or community buy-in, it's another part of this illusion. And we have seen this before. There are a couple of examples that have been documented. IBM Watson for oncology, for example, it's one thing that comes to my mind. This was a very high upfront investment project. There was poor clinician trust, and inconsistent recommendations and outcomes led to eventual withdrawal. And that resulted in very high costs that were lost and, of course, reputational damage. So this has been documented. What has been the economic impact of that? Of course, low adoption. That's a natural, duplicated labor, more tests, referrals, admin, and just insecurity from people involved. Poor uptake, of course, leads us to poor economic outcomes. We, as economists, like to use a couple of measures: cost effectiveness, rate of investment, cost utility, cost benefit ratios, you name it. So in terms of good approaches, or perhaps good practice, I would say co-design with clinicians and patients will deliver an impact and a benefit. Following clinical safety frameworks and understanding risk and mitigations, make them clear and transparent, will help people to develop this trust. Pilots should be accompanied by evaluation and regular monitoring of outcomes. I'm working on evaluation, so please do have this in mind at all stages in the journey, before, after, and during. Right, my reflection number 2, ignoring equity undermines cost effectiveness and cost utility. What does this mean? If AI systems perform worse for certain populations, they deliver fewer QALYs. We like to say this is another measure, quality adjusted life years, per pound spent, per dollar spent. An AI system that works for fewer people it just doesn't simply, it's not efficient. Even if it looks cheap up front, believe me, over the long term, it won't. So a bad approach would be evaluating AI on average performance only is not a good way to go. Normally, and sadly, we find this in the evidence, but that's not the way to go. Disaggregated outcomes by ethnicity, language, deprivation, and disability are much more reflective of the reality. So assuming productivity gains are evenly distributed, that's part of an illusion too. No, let's think further. There is a lot of complexity with our population groups and our realities and health systems all over the world. So please, let's not try and reduce that complexity. There is also evidence showing that some algorithms systematically under-identify minority groups. This is going to be costly over the long term and medium term. So please consider this at all times. What are the economic consequences that have been documented? We all have heard about misdiagnosis, repeat visits, cancellations, higher long-term costs, worse outcomes, and of course, this should be captured by evaluation and monitoring if this happens. So please consider this as a good practice. My reflection 3. We need to come back to economic basics in this AI hype. So we often skip fundamental economic questions, going quickly to the savings approach. Let's come back to it. Let's take a step forward and ask, reflect, What is the opportunity cost of embarking on an AI deployment? What are the things that we are not doing because we are taking the specific deployment on board? What are the initial and ongoing costs? We're not just talking about licensing, training. We are also talking about governance, monitoring, continuous engagement, and refining, because people is coming back to refine the algorithms. What is the time horizon to estimate costs and benefits? Some type horizons will be more appropriate for some people, whereas others will be more appropriate for others. Let's take a step back and reflect on time. And also, let's reflect further on context. What works for a specific workforce? What works for a specific population and situation? Not everywhere is the same. People and culture are also important. So many AI pilots look successful in the short term within specific circumstances. Let's come back to the basics and please reflect on these issues. Right, my reflection number 4, engagement and commitment costs less than compliance if we think about the long term. So we have 2 pathways for implementation. One is engagement and commitment, but the other one is compliance. What does engagement and commitment look like? This is co-design, when we bring people on board, change management, training, and developing the psychological safety. It is really important that we think we are working in a psychologically safe environment. Community and workforce involvement. These costs upfront. So yeah, we have to talk freely about it. This is a cost, and we need a cost and investment, but we need to think about it. On the other hand, compliance. So this looks more like mandates, targets, audits. Let's just think that probably compliance looks cheaper initially, but over the long term, this will make an impact. So engagement is a capital investment. Let's look at it in that way. Compliance will look more like an operating cost that compounds over time. So let's just bring the time horizon as well in mind. So when AI is pushed through compliance, costs may reappear later as reprocurement, and we have seen that in a couple of cases in the UK context. Reprocurement is really costly. Redesign, regulatory remediation, workforce resistance, and attrition. This is really costly. So please, let's just have that in mind. I'm going to finish with my reflection 5. Digital inclusion must be part of every business case. Digital inclusion is not an extra, it's not a tick box, it's not an add-on. It directly impacts economic outcomes. If digital inclusion is not considered as part of a business case, the business case will simply be wrong, because it will be not reflecting the reality of population, the reality of diversity, and the reality of the context. So just as a wrap up in terms of digital exclusion, please consider digital exclusion includes skills and confidence, access to devices and connectivity, language and cultural differences, trust in systems, and psychological safety. If we have that, value for money will not be compromised. So in terms of good practice, I'm just going to say, decision makers, it doesn't matter if you're part of public, private institutions, SMEs, private companies, we all need to pay attention to digital inclusion when working in all this, and have that in mind. I'm just finishing with this. And to conclude, AI can reduce healthcare costs, but only if trust and equity are treated as economic inputs, not as ethical extras or checkbox. When trust is sacrificed, AI does not save money. In fact, it will burn it through poor adoption, inequitable outcomes, and failed change. So please, let's consider value for money, and we must design AI with people, context, and equity from the start. And I'm just going to finish with a quote that I gave last time that I think applies equally here. Change really does move at the speed of trust. So thank you.
Thank you, Alex. You know what? I don't know what you read, when I got webinar ideas listening to her speak.
Exactly. There are 5 points there and 5 great part of it. It is, I mean, I think it's refreshing to hear how we are arguing about all of these different points and in an open forum, that means we are already bringing up that transparency into the game. Because what I look at it is, prior to these things, if you look at the medicine, healthcare delivery and all that, it was a black box for majority of the patients. Now it is opening up that with all of these. That is what technology. I mean, I am a proud Silicon Valley technologist who's willing to disturb any and every economy in the world. And this is exactly the conversation we are having. And I'm so proud of it because if you think there are so many doctors and everybody is concerned because the patients are come more educated than previously and they're going to ask questions, they better be prepared. I mean, you can't just accept, status quo because they were not getting delivery at the best result. So it's a good and bad kind of conversation. Yes, it is going to impact some of them, but if it makes it better, the whole world, so be it. Yeah.
Thank you so much, Alex. I'm going to watch that 3 times
Thank
to
you.
digest everything you just said. And we're going to bring you back. We're bringing all the speakers back for the after party. Well, I think not everyone can stay, but Brian M. Green. And how are we going to do this? And you and I have had a number of conversations, and you've been, I think you spoke in February. You spoke in this series before. And something that really struck me the last time we had an exchange, I always learn something new whenever I talk to you. And the governance piece for health AI is it's coming into the foreground now. It was in the background. I think that's how I felt. But at the same time, it's not stood still, and the conversation has changed. Now, I'm wondering if you could talk about how governance builds trust. Sorry, there's no S at the end of that, and reduce costs, and how. Obviously, everybody knows this is more important, but how is this conversation changing?
Yeah, I think it's a great question. First, I want to say thank you and Happy New Year to everyone that's here today. I'm excited to be part of this conversation today and, love seeing all of my fellow panelists again. Some of us, it's been a while since we've seen each other, some of us not as long. I think that we are seeing so much change with AI being embraced in healthcare right now that the question of trust evolving, because trust has evolved, trust in AI has evolved, and the trust in our healthcare systems has evolved as that has happened as well. When healthcare leaders talk about AI reducing cost, they've usually almost always meant efficiency, right? Thinking of fewer clicks that happen, fewer workflows, less administrative burden. That's kind of been the context of how AI was first introduced into many discussions a couple of years ago. But what I'm increasingly seeing is that AI has introduced a different kind of cost. So we're talking about cost a day, but it's a different kind of cost as the AI challenge and AI discussion has evolved. And that cost is uncertainty, right? And everyone that works in healthcare knows that uncertainty itself is very expensive. AI isn't used just to automate tasks, particularly now that we're talking about agentic AI, right? It's changed fundamentally how decisions are made, how they're documented, how they're defended, within the context of systems, right? We've spent a lot of people that work in the AI world have spent a lot of the last couple of years just talking about models, which model might be better, what performs differently, issues like that. But we need the discussion to be centered on systems because that's where these things really surface, whether it's cost, whether it's trust, whether it's integration. Those all focus on the system itself and how you actually use AI as a tool or other parts of the system that you're impacting. All of this matters because liability, trust, and accountability in healthcare depend on being able to explain decisions after the fact. Traditionally, medical decisions. I think Ruben just alluded to the fact that, those of us who've worked in healthcare as well as patients, we've been used to decades of medical decision making, just trusting doctors, right? And a lot of what happens in the context of healthcare is a black box to us. With AI, that's changed things fundamentally. People have access to information. Patients have access to information more than ever before. But we still need to be able to explain how the decisions happen and how AI has impacted that decision, especially when something goes wrong, right? And that comes back to governance, my favorite topic, I guess. But when AI is introduced without clear governance, cost are going to show up indirectly. We have higher liability exposure, right? There's more defensive behavior. So if someone's questioned in the healthcare context, a provider, for instance, or an administration of a hospital system, become defensive and may not be as transparent as they need to be when they're utilizing AI. You have insurer questions. And then you'll have, as a result, the slower adoption, right? That people are less likely to, in large healthcare systems, adopt AI if they have not been able to contextualize these things correctly. They'll adopt them slower compared to a healthcare system that may be smaller, that is less risk adverse, as Akanjali mentioned earlier. So even if we don't see that outcomes worsen when AI has been utilized, if we haven't factored in that cost of uncertainty or the cost of risk, right, then we're going to see the challenges with AI adoption and inability to get from a pilot where you can kind of quantify some of the risk a little bit better to getting to scale, where it's going to be a lot harder because you haven't factored in the system factors that are costs themselves. So again, the cost isn't the AI itself in the situation. The cost is the uncertainty around it. That brings us to not just AI governance, like I mentioned before, but it brings us to what I call proportional governance, right? So governance needs to be proportional to the level of risk. I don't mean, that you need a huge number of heady committee structure that review everything. You don't need to slow innovation necessarily, but you need to match the level of oversight, the level of governance that's required to the level of risk. Low risk uses of AI need lighter governance, and high risks of AI need more structure and more clarity. And there's plenty of examples like this. We can see the lower bar risk use cases right now that have been implemented in lots of healthcare systems. Ambient listening. AI can be used to summarize notes, help with scheduling, and in those contexts, proportional governance might just mean transparency to patients. Okay, we're consenting you to the use of this in your healthcare visit, and then basic validation of identity, right? So these are some kind of basic ways of ensuring appropriate governance. Those are lower risk, for the most part, scenarios. There are higher risk use cases when AI is used to influence clinical decisions, like triage, risk scoring, right? Then proportional governance requires clearer documentation, training of the workforce, the healthcare system, the providers on the limitations of AI and how to govern it effectively, and then clarity around when human judgment is needed to override the model, or when things need to be triaged for human review and or sign off, or reversing the effects of what the model might have suggested. And if AI is embedded in workflows that can meaningfully alter or affect patient outcomes, then proportional governance is at the highest level, right? Proportional governance means defined accountability, auditability, the clear audit trails, and alignment with patient safety and risk management. Some of the considerations that Alex just mentioned around traditional HEOR research, traditional health outcomes and effectiveness research that are kind of like econometric models of ensuring safety, managing the risk in terms of the metrics that we need to be able to measure. That's when that triggers that kind of highest level of proportional governance. Now, the proportional governance kind of language shouldn't sound that unusual or new to people in the EU, because the EU AI Act is organized with that kind of tiered level of risk and tiered level of governance. But in other countries, like in the US, who don't necessarily embrace that risk-defined level of AI governance, it may sound like something new, even though, I don't think proportional governance itself as a concept is new. We just may not use that term as consistently as we might need to. But essentially, as I said, you don't need to govern everything the same way. AI governance is not identical across the board. You govern it appropriately to the level of risk, and that means proportional governance. The good news is I'm already seeing these conversations come up when talking with healthcare organizations. Jose, as you said, the conversation around AI governance has been increasingly happened in the last year. And I do believe that 2026, I hope, and believe that 2026 is the year of actually talking about the realities of AI governance. The question isn't, should we use AI anymore in healthcare? It's how do we capture value without creating new forms of institutional risk, increasing the liability exposure, for instance. And that's where cost, trust, and governance stop being separate conversations and start being the same conversation. They start being truly integrated and having this kind of conversation where trust lies at the center of this conversation. AI can reduce healthcare cost, but only when governance reduces the uncertainty around AI at the same time. And that's where trust lies. I think Alex mentioned cost effectiveness, evaluative frameworks, and treating governance as, well, my words, treating governance as infrastructure provides us with the metrics that would allow us to right-size the ROI of AI and factor in proportional governance into what that cost effectiveness means in practical sense. Yeah, that's what I think is really going to be kind of critical in our discussions in 2026. I do think that cost and AI governance are central to those conversations, and that will do nothing but improve the trust in AI from a systemic perspective. How is it integrated well within systems, and then how it affects patient conversations and patient outcomes eventually, where we'll start to see the data, we'll start to see the metrics that become very clear. Once we're effectively putting in the measures that we need, proportional governance allows us to have clear metrics. Those clear metrics show the ROI that's a real ROI for AI utilization, and that can't do anything except improve the trust of AI within our healthcare systems.
No, I think that's a very nice way of putting it. I was thinking about the industries are getting disturbed by AI. I see three of the professional thing. One of them is medical, healthcare, that part of it. Other one is financial, for definitely, because they look for money optimization and like a mainly high frequency trading and all that. The third one is legal. I mean, law firms and all that. All of these three, one side, as you said, it needs to be brought in. Other side, the compliance, trust, everything. But again, medicine is in its own parallel because of the human directly involved. But all of these professional areas having that kind of conversation and hopefully all lifting it up together, because of one side is compliance for fraud, other side is compliance here for death, or it's a very severe part of it. It's important. Yeah.
Thank you, Brian. I agree. Conversation is going to be very different. Mind you, it always changes, and it changes very quickly. We're going to bring Brian back in about 20 minutes for the after party, and our next speaker. And oh, I can't. Melissa, you there? I can't see you. Let's see. Go
Yes,
to my
he's
other
there.
tab. And there you are, Melissa. And by the way, Melissa, Santa Claus, something came down the chimney at Christmas time. Oh, can you see it?
Oh, you have my book. Oh, that's so sweet.
I was very surprised, actually, that this came down the chimney because we don't actually have a chimney. And I actually just unwrapped it today, just before the webinar.
Oh,
And
oh.
and actually, I brought you on towards the end. I want to talk about crunch time. Melissa, by the way, is our human expert. Well, she's not ours, but she is a human expert. And there's something actually that you posted. I think you posted it recently or around Christmas time that I was like, oh, I want her to talk about that during this webinar. And because we've just had Brian, we've had everyone talking about, and we get this a lot in our events. And obviously, I'm not poo-pooing what we do. You get the lofty ideals that people start with. But you know, and I know, that when you're working with a startup, there's enormous pressure after the start of the project. There's a moment, there's usually a moment. Competitor just raised $100 million. There's a trade show coming up, and we're not ready. The customers want this feature, we don't have it, and something happens. And there's this enormous pressure to do something. And those lofty ideals that a startup may have started with, an organization may have started, people say, well, just for now, we want to get over this hump. We're going to discard this principle that we've said that we're going to adhere to, just to get this number up. We want to get this line up. And you and I both know that has a way of becoming permanent. Now, I wonder if you could speak to two different kinds of people here: leaders who are feeling that pressure, and people who are working under them that want to be the voice of Jiminy Cricket on their shoulder, but in a productive way.
And I tell you, the stakes are so much higher in healthcare, both because we're talking about people's lives or their loved ones' health. It's so much more important in healthcare. It's just so common, like you outlined, to have all of this pressure, the pressure to get more sales, launch new things, all of that pressure is there. And then with that pressure comes the ability to step into some of these gray areas. And the beauty of this topic that you have today, focused on trust, when you're leaning into those gray areas, you're going to oversimplify, you're going to overpromise, you're not going to protect vulnerable populations. And all of that erodes trust. And that's where we have to remember that doing things ethically doesn't slow down your growth. It protects you going forward and protects the trust, particularly in healthcare with our patients. There's nothing more important. Trust really is the currency of healthcare. And what do I mean by patient trust? That just means patients believe that their providers or their healthcare system has their best interest at heart. And when you're off here oversimplifying, overpromising, and not protecting vulnerable populations, you're proving you don't have your patient's best interest at heart. And the interesting thing is there's actually a study published last year by a researcher at my alma mater, the University of Minnesota. And in that, it was about patient trust in AI in the healthcare system. And in that, the majority of respondents, the majority of patients, said they don't trust the healthcare system to use AI responsibly, and they don't trust the healthcare system to protect them from AI-related harm. So when we have to think about protecting vulnerable populations, those vulnerable populations, it's not that they don't trust AI, they don't trust the people in charge of AI. And that's where it goes back in my mind. And we've talked about this before. Whenever I talk about trust, I remind people, you build trust by being transparent, consistent, and empathetic. And when you're oversimplifying, overpromising, and targeting vulnerable populations, you're not being transparent, consistent, and empathetic in your communications. And I applaud Ekanjali earlier. She said trust is not a communications issue. And I'm the communications and growth person, and I will agree, trust is not just a communications issue. It needs to be systemic. And when we're focusing on things like healthcare AI, like we're talking about today, Brian actually mentioned it as well. Transparency is key. Patients want to know how we're implementing AI, where we're implementing AI. Is it going to replace the human factor? We have to lean extra hard into that transparency. And then we have to think about consistency. And that's having these same messages at every touch point for your patients. That means on your website, in your communications, the person who answered the phone, your nurses, your doctors, everyone across the system, the billing folks, everyone has to be on the same page and kind of singing from the same song sheet. And lastly, it's about empathy. So that scenario you outlined, when it's pressure, pressure, pressure to do more and cut corners, we have to remember in healthcare, empathy has to be woven into everything we do. We have to remember that our patients are concerned and they have mistrust about the safety of AI, the safety of how we're implementing AI. They're not sure. It's not that they're not sure about AI. They're not sure about the system is going to protect them. And for me, that's all about empathy. And there's, of course, on the communication side, I'm all about empathy and communications in healthcare. But we have to remember that everyone, all the tech folks implementing AI need to remember that they need to keep patience and empathy at the core of everything they do. So I love that scenario you brought up because it's real. There's that kind of pressure and there's that kind of speed around the implementation and innovation around AI in healthcare. But healthcare is a different industry. We can talk about financial services, we can talk about manufacturing, we can talk about everything else, but we're talking about lives. And all of us on this call, we're all healthcare consumers.
Actually, Melissa, I'm a University of Minnesota alma mater too, Minnesota. And
It's amazing.
Yeah, actually, it's amazing. And one of the things I've been collaborating and talking to people at Mayo Clinic, which is based out of Minnesota and many of these places, one of the things they have done amazing job is, involving technology and lately AI into a lot of post-care or, supporting the, patients because Mayo Clinic can be expensive because they are very selective. They are very good at what they do. That comes with the cost part of it. So they are official from, they have, I think, I don't know if people know, the Mayo Clinic has two, like a co-CEOs. One person is the doctor. He has to be Dr. MD. The other person is a business or technology expert. So because they put them together, because I met one of them at last year, the JPM conference, and they were, the way they put it together and try to go and deliver those trust one side and other side the cost reduction, because without that they can't pay these best doctors and able to charge these patients too. So it is I think it's amazing to hear what you are saying, and the trust is so key.
Yeah, and Mayo is doing something interesting. I would call them kind of the gold standard around transparency about the use of AI. They've really leaned into making sure people understand what is the provider's role and what is AI's role, and that one is not replacing the other. And so I think Mayo is a model that I really encourage other healthcare providers to follow as far as that transparency and openness. So absolutely 100% agree. And I love that you're focusing on our Minnesota healthcare providers.
Yeah, I think to the audience, if they are listening, I got today morning a note from one of my friend who is a business development executive at Mayo. they are hiring a lot of interns for next year, next summer, in AI and technology at Mayo Clinic. So if you guys go to Mayo Clinic website and look for a job opportunity for interns or your family members or your students and all that, because there you get to work on healthcare one side, but technology on AI, how it is getting, and they have a lot of opening there.
By the way, everybody, for the people on LinkedIn Live, I have put in the Zoom webinar link into the chat. You see at the very bottom of the chat. And because in 8 minutes, the LinkedIn Live ends, but we're going to an after party. And the people in the Zoom webinars are going to say, what's all this weird text Jose keeps pasting in? Those are the comments from the LinkedIn Live, actually. And we're going to get to that. And I'm going to bring on everybody. Group hug. And Miller, I can't see Miller. Where is Miller? You know, I want to get to these questions. And let's see. Add spotlight.
He's sitting on the top.
There he is. Welcome, Miller. And Miller, he's going to get a spotlight too. You're going to kick off the after party. But before we go to the after party, I haven't even had a chance to read all these questions. We've got so many. But we've got one from Sarah. And do you find that some pilots are designed around an idealized version of clinical workflows rather than how work is actually done? I think, Akanji, do you want to take the first stab at that one?
Oh, yes, absolutely. Wonderful question. And it kind of brings me back to the point that Melissa made earlier around oversimplification. So workflows in healthcare are not the same. They are not consistent from one organization to another. Perhaps within the very organization itself, an appointment may be booked a different way in one department versus another. So there's a real risk, and I see it time and time again. I see a lot of the speakers nodding as well, of that oversimplification of the workflow. So we take sort of a best case scenario of this is what usually happens. So let's just look at that. But have we really workshopped the 15 other iterations of how this is done? Have we really workshopped if something fails in that workflow, and then what the impact of that is on us or on the tech or on the patient? I think that's the delta that's often missing.
And do people on LinkedIn Live see the Zoom webinars link? Hopefully I pasted it in right. Let's see. Give me a thumbs up if you see the Zoom webinar link. And so I'm toggling back and forth between the two. And I'm going to read some of the questions from LinkedIn Live. And actually, this is the first time we've had more people on LinkedIn Live than Zoom webinars.
And not just that, actually, people are interacting with each other also. I see Bhupinder responding to some of them, as well as there are other people asking questions, follow up, and connecting. That is the goal of this kind of meetup. It's not us speaking to the audience, and we want to create an ecosystem of collaborators, and that is we want to leave as SenzMate. We are so proud of that, coming from one part of the world. We are connecting everybody across the globe.
Laura, and this actually is a comment to I think it's a comment in response to Alex. Well thought out engagement throughout, and it needs to be two-way. Clear communication of intention, but also really listening to staff concerns and ideas. This builds trust, supports change management, and facilitates rapid learning cycles. The evaluation process can be part of this engagement while also structuring data collection and insights. As Alex mentions, our team can support with evaluation and also some broadly with engagement and industry support. That's from Laura Boland. And that's not a question, though. Did anybody want to comment on that? Comment on that comment. Can
I make a comment on that?
Yeah, go ahead, Alex.
Yeah, just to mention the rapid learning cycles. This thing of trust reminds us, let's reshift into a learning culture rather than mourning on the mistakes or potential errors. This is a matter of moving forward, learning, feeling psychologically safe to learn with others on the way and correct. And I think evaluation, monitoring, and continuous reflection helps us doing that. Let's learn on the way and correct as soon as we can. Bring people forward, bring people on board. It doesn't matter what happened in the past, but we are living now. Things move very quickly, and let's do something as soon as we can to correct the path. And I think that just brings psychological safety to all the people moving on in things that are at times uncertain. And that's fair enough. I close with this. Thank you.
Thank you. And Alex, you have to go. Are you able to stay for the after party?
I can stay for a couple of minutes, 10 minutes more and I'll go. Thank
Can
you.
we get your final word before you turn into Cinderella?
I think probably that's my final word, and very happy, and I welcome these conversations on things that are really innovative. People feel that generally, from my experience, trust doesn't come up in a lot of professional conversations when you are evaluating, at least, or when you're delivering and designing interventions, and it's really, really important. So basics are really important. Sometimes we take them for granted. So I'll finish with that and welcome the effort that SenzMate has been doing in creating an ecosystem in which we can keep reflecting and reshaping these concepts as we move forwards.
Now, Jose, I have to drop now too.
And Melissa, can you give us your final word before you go?
Yeah, absolutely. And first of all, just again, thank you to you and Ruben for having this conversation and raising the topic of trust around AI. It's not just about innovation, it is about trust. And I'll say that the question isn't whether AI can reduce healthcare costs, because we know it can. I think the question is, well, whether we're willing to lead it with clarity, humility, and purpose. And I guess I'd add integrity to that.
Thank you so much, Melissa.
Thank
I'm
you.
cracking spine on your book tonight.
Thank you so much. That's very sweet of you to get it.
Well, thanks, Santa. Take care. Okay, we're starting the after party.